County. That explains why we're here. The Orc is a nonprofit that's part of a series of nonprofits that our mission is to promote the rights and well-being of people with intellectual and developmental disabilities. So we strive to make sure that people with developmental disabilities can be in control of their own lives and make decisions, and that means being able to access education, employment, housing, etc. So we do a lot of things at the Orc, but one thing that might be relevant to you as parents is that we do our information and referral service. We can provide information and either assist or refer you to someone for any issues you might be facing as a family. One of the common ones we get, or some of the common ones we get, are issues with Medicaid, IEPs, etc. We also help run the parent-to-parent community organization in King County. So parents giving or providing like support to peers, and lots of other excellent services. We do supported living. And we just now recently opened an excellent new office in SeaTac. So if you're ever down there, you can come by and see us. We have some affordable housing up top. And yeah, we'll get a little bit more into like what DDCS does, but that's what the Orc does. And if you ever need any help, feel free to reach out to us. Oh, we also do fun trainings like this.
That's right. And also, everything we do is free. Like, or not everything, but the things we would do for you will be free. So if you call us and ask us questions, you don't have to prove a certain level of need or a certain level of disability. We're just there to answer your questions and really like to do that. Mm-hmm. Okay. Any questions about the ARC?
Is it too early to ask what the supported living program is?
Yeah, no, it's not too early. Our supported living program, so we have about 50 adults with disabilities who live out in the community, and we have some of them who need a few hours of care a week and some who need 24-hour-a-day care. And we oversee all of their care needs. So we have about 150 staff responsible, that work kind of around the clock on their staff. And this is a service through DDCS. So in order to be in a supported living program, you have to be a DDCS client.
Got it. Okay.
Yeah.
Through providing respite care and personal care. People with developmental disabilities can use it to get help for in-home, out-of-home, and community-based services. For people who are going to need long-term services, DDS is probably going to be involved. It's just too expensive to fund or to personally fund the kind of services people are going to need. So yeah. As we mentioned earlier, a significant reorganization is going on within DDCS right now. No?
I think a thing to keep in mind is that if you have a loved one, if your child is a person who's going to need ongoing care into adulthood and they're going to live in Washington, that it's going to come from DDCS. And that's part of the Washington state government. And it becomes more useful the older they get in some cases. If your kid is I'm curious, how many of you have kids that are in elementary age or younger? Oh, all of you, okay. Or the vast majority, right, okay.
Okay, so like Rachel was saying, DDS often provides more services. The older kids get is kind of skewed or towards adults, but oftentimes what people are interested in DDCS services is, like I was talking about, personal care, which is supports basically for activities of daily living, bathing, hygiene, eating, transferring, stuff like that. So you can get funds, or you can get funds to get personal care. They can hire their own people, or they can go through a supported living agency. But yeah, and then also respite care. So respite care is care that, in your case, is your child gets. It can be in your home or in the community, but it allows parents and other caregivers to have a break, basically. And we'll talk more about that later. And then on top of the respite care and the personal care, we also have a lot of other programs. There's some support for housing, the school to walk program, which is a little ways off for all of you now, but when your children grow up and are making that transition from school to adulthood, that's paid for through DDCS. and they have a lot of other services like that. And so the way you get services through DDCS is through waivers.
Before we go on,
sorry.
let's just see if anyone has any questions.
Oh, okay. Anyone have any questions so far about DDCS?
It's so much information that I'm always so aware we're just like throwing this super technical info at you. All good so far?
Okay, great. Okay, so yeah. So again, all of these things like this, personal care, respite care, are ongoing and they're costly. They're not really something that individual families can pay for on their own, and that's why it's important, kind of as soon as possible, often we say, to start enrolling in DDCS. Even though the services available when your child is young might not be, they won't get as many care hours because there's kind of this assumption that, the parents will provide that and stuff like that. But it's good to basically get in the system, access the resources that you can, and then also when they see you accessing the resources, it makes them more likely to offer you more resources in the future. So yeah, DDCS is also useful if you need. They have some crisis respite services, so if that ever comes up, it's really useful to have. And also, having people enrolled in DDCS allows the state to plan ahead, which is especially important right now as we face a budget shortfall. It allows the state to plan ahead and kind of understand how many people with disabilities needing these kinds of supports are in Washington and, earmark for that. So again, we urge you, if you have the opportunity, to apply for DDCS. Yes.
Can you give an example of crisis respite care? Would that be applicable?
So respite care is basically, you're familiar with how respite care is, and I'm more interested in the crisis aspect of it.
Yeah, I know it's just applicable to the kid who's eligible. I'm not sure what the crisis, what situations that would apply to or what that means.
I mean, I don't think that DDCS would be specific, that's not enough of a crisis. I think it would be if the parent identifies a need for crisis care, they would try to find it. So I think people would use it say you're the primary caregiver of your person and then you break your leg and you're not able to provide that be that caregiver or you're going to have surgery or someone dies and you need to go to the funeral. I think it's worth pointing out though, in reality, finding it when you need it in that crisis and I think it's also more available for adults than it is for children.
Gotcha.
But it is a thing that they say is there. If it in reality, I don't know.
Yeah, that is also a reoccurring thing that we're going to talk about
A
in this presentation.
reoccurring theme.
Is this a lot
right.
of things that people should try to get the DDS. The DDS says they have, and we're here to help you try to get them. But the actual navigating the system can be difficult and frustrating.
Right, the thought of shattering your leg and then trying to find an emergency caregiver feels like it may never happen.
Yeah. So who can access DDCS services? So anyone with a developmental disability in Washington can access DDCS services. It's not income dependent. On the other hand, there are some limitations. First of all, immigration status. So technically anyone can be enrolled in DDCS regardless of immigration status, but most of the services, the personal care services, the respite care services, all paid for through Medicaid. You actually, if you are on DDCS, you automatically have access to Medicaid, but in order to have Medicaid, that has citizenship requirements. So unless you are a citizen or have certain other visa setups, which we can, if you have questions about that, we can talk to you more about later, then you can't access most of the useful parts of DDCS, which is frustrating. So in addition to the immigration, the disability must also meet Washington State's definition of a developmental disability, which is not the same as the laws of federal government's definition or the definition of disability in general. So a developmental disability has to have originated before someone was 18. It must be ongoing and expected to be ongoing, and it has to result in significant limitations of activities of daily living. So diagnosis alone is not enough. You do have to be diagnosed with either a developmental delay if you're under 18, cerebral palsy, epilepsy, autism, or an intellectual disability. On the other hand, you can have like autism or cerebral palsy and not qualify for DDCS services because they determine that you do not require enough support for activities of daily living. One of the things is there has to be like at least support for at least 2 activities of daily living, and they have like a list of it.
Do you guys know what activities of daily living, like things like washing, showering, feeding yourself, those kinds of things?
Yeah, so medical diagnosis on its own is not enough. You have to, when you're applying, provide, you don't provide that. Your person's doctor will have to provide, and therapists will have to provide evidence that they require that level of support. Any questions about who can access DDCS services? Yes.
So my son has developmental delays, but also what's called apraxia speech, and so his will be ongoing and it's severe. So would that be one that would be, because it's not up there, so I'm just curious.
It would fall under developmental delay.
Okay.
And once he reaches 19, he'd have to have some other diagnosis by then. So it's not it isn't listed up there, but it kind of falls under. And so one thing, for anyone whose kids received early intervention services, in like 0 to 3, I saw a lot of nods. Your kids were automatically enrolled in DDCS. Right, nobody knows. And I was a parent of an early intervention student too. I was a little overwhelmed. I also did not know. And when they turn 4, it expires unless you reapply. So for anyone whose kids are still under 4, they're actually still in there. For anyone whose kids are over 4, you probably received a letter at some point that was like, warning, your eligibility is going to expire. And you're like, I don't know what this is, and I don't care, and I'm going to ignore it. But developmental delay, just by qualifying for early intervention, qualifies them for that.
Yeah, so you reapply when you're 4, if you had like ESID or anything like that, and then also when you're 19. So after you turn 18, you apply again. Then if you get it when you're 19, then you're in for life. So those are kind of like the 2 major.
And can I just want to jump on that and add, we have this link, and this PowerPoint will be available for anyone who wants it. It's where it says a medical diagnosis is not enough. If you click on that, it brings up the actual test scores that a person has to have to be eligible for DDCS. There are other portions of the process where your story and like how hard it is day to day are taken into consideration more. But for eligibility, they just want to know, do you have like enough of a deficit in your test scores? And they're primarily looking, like if you have a child who's autistic, they want to see an autism diagnosis and they want to see low adaptive scores. Adaptive is like acts of daily living. If they have cerebral palsy, I think they need to show that they need support in like 2 or more areas.
Yes.
So that it's very specific what they need for each of these diagnoses. Yeah.
How many years, how the scores, does it have to be within so many months or a year that is with the application, or?
I haven't heard an actual number. Have you heard if it's more than a certain amount of years?
I haven't heard a strict thing. It is said it's supposed to be recent. I feel like that's often what they
say. So I've heard them sometimes require someone, but this would come up more in adulthood.
Yeah.
Because my daughter's 3 now, so I did not know I'm still covered under this.
Oh, you are?
Because we did birth to 3. But yes, I don't know any. I'll have to ask you guys probably questions later. But she got diagnosed at 2. So
nothing. A 3-year-old, everything's valid still.
Yeah.
And the thing is, when they're in school, they get tested every 3 years in school. So you will always, while they're kids, have pretty up-to-date testing if you're participating in an IEP process at school. It becomes a bigger issue in adulthood when they've been out of school for 10 years and they haven't had any recent testing. Other questions about DDA eligibility? That's a thumbs up. That's good. I always say, because I never know with this stuff, if it's so confusing, people are staring at us like, I don't know what you're talking about, or if they have no questions because we're being so clear. But I got a thumbs up, so I'm going to assume we're good.
We appreciate the feedback.
Yeah, exactly.
If anyone could just do a little emoji, that would also be great. So how do you become eligible for DDCS? So again, at this point, when you're first applying for DDCS, it is kind of a yes or no thing. The test scores either indicate that your person is, qualified or can be enrolled in DDCS or not. On the other hand, the application itself doesn't take a long time. It's 2 pages, and one of those pages is a confidentiality thing, basically giving the school and the doctor's permission to send our records. So yeah, it takes about 30 minutes. If you need help, we at the org can support you filling it out. So yeah, it's basically proving. I'm gonna go here. Do we want to show them the?
Oh yeah, we did talk about doing that. Let's see if it works. We include. Oh, it's not showing on the screen. We can skip it. I mean,
okay, yeah.
The thing to note, I think parents get very intimidated or a little worried that it's going to be a real headache to do these applications, or that they're going to have to gather medical records, which is also super intimidating. And I want to set you at ease that it is a non-intimidating process to start. It gets more stressful down the line, I'm not going to lie. But this part, at least, is not so hard. It's like name, address, phone number stuff. The second one is consent, like Elizabeth said, giving permission for them to share records. And the third one is if they're an adult, a voter registration.
Yeah, your 4-year-old doesn't need to register to vote, so
they're good.
Not really a worry.
And those are links, so when you have the PowerPoint, you can just download them and print them out.
So after you become DDCS eligible, the thing is we say it's kind of then you got into the restaurant at the line at the door, and now you have to wait to be seated. So you get your thing, your email, your letter. It says your person is eligible for DDS services. Yay. So now you have to actually request specific services. And a lot of people kind of get confused at this point and then end up not requesting services. So when
this
you
is
get
where
this
you
letter,
are in the process.
Yeah.
You're eligible, but with no services
Yes,
and
exactly.
confused. Right.
Yeah, exactly. So when you get that letter or email, it should tell you, but basically you will be assigned a case resource manager, and you contact them to enroll on a waiver. So we mentioned, again, waivers a little bit earlier. And these waivers allow you to access all the supports you're talking about earlier, things like employment support, personal care, respite. Then also we have best behavior support, which is a program to help support for kids 4 to 19, I think. They'll come to your house and kind of help work on behavioral goals. So, and that one's the one that you don't have to wait too long for.
And the thing about the best behavior, that's the only service DDCS has that is not a waiver service. So if you're not on a waiver, but you're DDCS eligible, like your child would be eligible for this BEST program, which is a behavior program where they come to your house and coach you as the parent on, and it's free, and like Elizabeth said, not that long of a wait. Yeah.
Is that the same as the behavior support team?
Yes.
Yes, no. Okay, so yeah. So waivers, some people get confused why they're called waivers. The idea is we used to institutionalize people at way higher rates. Luckily, we don't do that anymore, but theoretically, this is a holdover. The term is a holdover from that. It's saying you're waiving the right to get services in institution, instead getting them in the community, which is what we like to see. So a waiver is a package of services. They increase in level of support based on the person's needs. So yeah, most families will start with individual and family support waiver, and they'll move up as needed. The way that it is determined what waiver you're on is that you will have a care assessment. So they will come to your house and they will ask you questions, ask your person questions, basically trying to assess what the level of support needs are, and then they will plug all of that into an algorithm, and it'll spit out a number of care hours and also other information about what kind of supports they're willing to give you. And this is where your advocacy can come in more, because they have this algorithm and stuff, but also you're going to want to kind of be in contact with your case manager and make sure they're aware of any changes in the situation, a change in diagnosis, maybe troubling behaviors, incidents, or your levels of access of outside non-DDCS care. All of that is stuff you want to keep them abreast on, because it can help you to get a waiver, either a different waiver or a waiver sooner, which is good because all of this is a kind of like months-long process, mostly because DDCS is just so backed up and getting more so. So especially now with the like current threats to Medicaid and the big beautiful bill, we definitely recommend that people try to get on DDCS as soon as possible, even if you don't need it now, because it'll take a while and you'd rather have it before you need it. So yeah. So, and also when you're enrolled in waiver, you become eligible for Medicaid, regardless of your income, and that can be very useful for health insurance as well as care. Any questions about getting enrolled on a waiver? Yes.
I have a question. So my daughter did the 0 to 3 and she's not 4 yet. So does she have to have a waiver before she is eligible for Medicaid? Or
Yes.
Is that,
Yes.
Okay.
But
That's exactly right. So you are in the same position where, and the next slide will show you what to do next.
Yes.
There's a link you click on,
There
and
we
it
go.
will tell you exactly how to request services.
yes,
I think
basically.
there was sorry, go ahead.
Oh no, you go. Yeah. Is there another question?
Yeah, I thought I saw maybe another hand up. But
Oh yeah.
Is it the same if you apply the Apple Health?
So Apple Health, that's Medicaid in Washington. That is health insurance for low-income people. So you have to meet financial eligibility requirements. You have to be low income to qualify, unless you are in DDA and on a waiver, and then you get Medicaid whether or not you're low income. So you could apply for Medicaid now, but if you're not low income, you'll be denied. If you wait and do it like through DDA, it's just for your child. The rest of the family doesn't get it. But like my son has Kaiser as his health insurance. He gets it through my work. And then he also gets Apple Health through his DDA waiver as a secondary insurance.
My son was birth rule, what's that?
Birth to 3,
Birth to
yeah.
3, yeah.
And he's in the IUD right now.
Okay.
He's 4.
So his eligibility has likely expired
Yeah, because I received the letter and I didn't know.
because nobody
Yeah,
does.
yeah.
It happens all the time. I'm always begging the early intervention providers, please remind them before they age out to pay attention. But you'll have to do the re-eligibility with those forms we showed. And then once he's determined eligible again, then you can request a waiver.
Because there's one that I called as the Washington Health Plan Finder.
Yeah, that is where anyone in Washington who's low income can go get health insurance through Medicaid. But if you're not low income, that is not the place to get Medicaid.
Cancel it. They automatically do.
Yeah, you're not low income enough for it.
But I can apply for it.
Well, for your child. Yeah, through DDA. Yep.
If he gets a waiver.
If he gets a waiver. That's right. And I think Elizabeth's point, like, I just want to emphasize that. We know that there's big cuts to Medicaid that have gone through at the federal level. And we know that in Washington, our disability services, more than any other state, are covered by Medicaid. So those cuts are going to impact us and impact DDCS in a big way. So we don't know how yet. The cuts haven't gone into effect yet, but they will in the next year. So the advice I'm giving families is like, now's the time. Because I think it's going to get harder. I think they might tighten the eligibility requirements. They might have less staff to actually process the intakes. So now's a good time.
So you basically have to explicitly say, I'd like to request a needs assessment in order to be enrolled in a waiver. So at this point you'll get, and you can call this number up here, you can click this link, and you can expect a response in 6 to 12 months or more. So again, this is why you want to do it soon, because there's a lot of waiting involved. So needs assessment, like I was saying earlier, this is the time when your advocacy really matters. Also, if you're already a Medicaid recipient, then your child can also be enrolled in a community first choice. And so you can call that number about that. Community first choice is basically another way for you to get like Medicaid and personal care services outside of DDCS. And if you already have a waiver and would like to increase services, you want to make sure you're using all the services they're giving you now, because again, they like to see that you're using the services. and then they can throw more services on top of that. So the problem is you can be, and this happens to people all the time, so waivers, sometimes they just won't have enough funding to keep filling waivers. So you can be like qualified, or your person can be qualified for a waiver, but there's not enough money to fund it. In which case it'll get denied. And it's based on like need. It's not based on like a first come, first serve thing. And so if you get denied, there's not a waiting list. You have to reapply. And so we recommend that people do that if they get denied, reapply every 6 months for a waiver. And while you're doing that, make sure you're in contact with your case manager and letting them know, again, what your situation is, any behavioral issues, anything that happens, any care support needs and stuff like that, because that's kind of how you potentially demonstrate your need and get more likely to get one of those waivers. And again, this is also one of the things we're worried about with Medicaid is as we have these Medicaid cuts, there'll be less and less funding for people to receive waivers. No? To put it in context, when I applied for my son, which was in about 2007 or 2008, we waited about 8.5 years for a waiver spot. It is not like that now. Before COVID, there was actually no wait for a while, or at some point in the last, I can't remember the time, COVID time is weird, but at some point in the past like 5 years or so, there's been no wait. Right now, they're back to kind of reaching capacity. Sorry, I forgot that was a microphone. Stop fiddling with it. But it could. They are likely going to be at capacity. And the way they're going to do it, they have a committee. So say this month there's 3 spots available on the waiver, and there's 17 kids statewide who are wanting those spots. The case manager is going to try to explain why your kid needs it more than any other kid. So you have to sort of convince them why. At this point, they've seen the records. They've gotten the point that he's disabled or qualified for the service. But this assessment, like she's saying, is the time to really. It's my once a year almost therapy. I mean, I don't know about you guys, but normally I'm a proud mom, and I'm talking about all the ways we've progressed and all the things he's doing great and how we've got this is fine. But that does not get you services at DDA, being a proud mom in those moments. At those once a year assessment, because they will do this every year for the rest of his life, once a year is the time to, this is hard. These are what, only if this is true. I don't want you to ever make it up if it's not true, but I would say things like, I'm not sure how much longer I can do this, like without any help, or we're barely holding it together. Those kinds of things. That's the time. You want to make sure they're clear that you can handle it, because you don't want them to get any feeling like you're not handling it, but you want them to know that you're not sure how much longer you could handle it for, if that distinction makes sense. Do you guys have questions about that? Okay, so now we're going to talk a little bit about, again, some of the more specific services. So we talked a little bit already about respite care. We're going to talk about what qualifies as respite care and what does not. So respite care is short-term intermittent relief for parents and caregivers, where the person with a disability receives care from another person, so the main caregiver can get a break. So respite care is not child care when the parent is walking, but there are many forms of respite care. It can be in your own home. It can be with someone who is already a caregiver. If you have like an adult friend or another adult like in the home who provides care, they can be paid for it through DDCS, which is great. It can also be in the community. There are a lot of programs through like the YMCA and stuff like that that can function as respite care, where they can go and do like soccer or other activities. And that you can get support through that through respite care. Can also look like after school care, camps, adult day centers, specialized classes, etc., all through DDCS contracted organizations. Sometimes you can also get overnight, weekend, or longer term respite care, including at a friend or relative's house or a licensed facility. So respite care can look a bunch of different ways, but the point is that it's to provide a break and a rest for the caregiver. Washington
State knows that we work hard as parents and caregivers, and it in their best interest that we continue to be caregivers. They don't want us burning out, so they give us breaks. And that's what respite care is.
Yeah.
Do we need to be on waiver?
Yes.
You do. That's the hard part.
Mm-hmm.
Yeah.
If you're
Yeah. Oh, sorry.
How long is the break?
Yeah, great. Now we're getting to the important stuff. It could vary. It could be like my son does a respite program on Sundays near our house that is every other Sunday for 2 hours. So that's not very much. He's also done one that was a week-long sleepaway camp in Tacoma. Not at 3 and 4, but by 8 or 9, he was doing that kind of thing.
And your respite care hours are also determined by these kind of care assessments and
That's
stuff
right.
like that. So it will vary depending on your person's need and your family's need. So for instance, they'll also look at things like what other caregivers are available and stuff like that when they make that assessment. So if you're not on a waiver for whatever reason, there are some organizations that can provide the same amount of respite care as the state can, obviously, but things like Lifespan Respite Northwest, if you are not on a waiver or receiving other respite care, can give you basically a voucher for some respite care. So if you guys want to go to that link, that can be helpful. So yeah, and there's a lot of different ways that respite care can look. Any other questions about respite care? No?
The whole thing about not being able to work while your kid is at respite care, if you ask DDCS, I need child care, they will say, we don't provide child care. When my son was at 5 days of sleepaway camp, I was absolutely working during that time. And when he goes to the thing on Sundays, I can do whatever I want. No one's really making me prove what I'm doing. But the law does actually say that it is not meant for childcare. They want you to rest during that time. They don't want you working, I guess.
Yeah. And if you want, this isn't DDCS related, but we can talk about later, they all can help you try to find other forms of child care.
Right.
Exactly.
Right.
But that's not DDCS's bag.
That's right.
So for personal care. So personal care, again, is help with these activities of daily living. We have a little list here of things that a personal care provider can do: bathing, toilet use, meal prep. I like wood supply. That's for a more rural area. If you need to chop wood for fire.
Heated by a wood stove.
Yeah, you can get
right.
wood supply.
It's better than giving my son an axe.
Exactly.
I'll tell you.
Exactly. So dressing, eating, essential shopping, etc. So a personal care. First of all, there's a lot of different people who can be personal care attendants. You do have to do some training, but again, if there's someone who's already providing care in their life, they can do that training and then they can be paid for that care. The parent can't, and neither can step parents or anything like that. But if you have adult sibling or an aunt or an uncle or something who cares for them sometimes, they can sign up to be a personal care provider. So yeah, and you can also hire personal care providers through organizations, through things like Carina, which is a website that helps you connect with care providers and stuff like that. So there's a lot of ways to find care providers once you have access to those care hours. So personal care providers can't provide child care, so they can't watch your kid while you're walking, and they can't do skilled nursing. But they can provide care not only in your home, but also out in the community. So if your kid is at camp or something like that, then they can go and they can provide all of these same toilet use, feeding, supports that they would need at home, but in the community. So yeah, only parents of clients 18 or over can become paid caregivers. So to find a caregiver, you can contact your case manager. You can also look through a contracted caregiving staffing agency, which there's websites online, you can find those through carinacare.com, and also, again, just have people who are already providing care sign up. Any questions about personal care and how that looks?
I have a feeling, since most of you are parents of younger kids, you're sitting here thinking, why would I want a personal caregiver for my child? I don't need someone to come to my house and give them a bath. I'm their mom or dad, and I'll give them a bath. that does change as they, for some of them who might still need help with a bath when they're into their teenage years or into adulthood. Like at some point, you may find that you're ready for assistance. And also you might find like, I know my son will always need help with a bath and I will not always be available to do it. So at some point, it will be these caregivers that are helping him with the bath. So at some point, I need to get me used to that. I need to get him used to that. Not when he's 3 and 4 years old, not even when he's 7 or 8 necessarily, but just something to keep in the back of your head. If you have a kid who you expect is going to need that kind of ongoing care, it is coming from these caregivers. And the amount of hours you get will go up as they get older. So they know you have a 3-year-old. Parents of 3-year-olds are really working hard caring for their kids, neurotypical kids or kids with disabilities. When the other kids are 7 and 8 and the care needs start to go down and our care needs are still there, that's when the more hours.
And once you become enrolled in DDCS, you will get assigned a case resource manager. So they are kind of like your first connection or your primary connection through DDCS. They're the ones you're going to be in contact with. CRMs are extremely busy. We used to say that they have about like 75 people on our caseload. It seems we've heard lately that it's more like 125 now. So they do not have a lot of time. That just means, though, that doesn't mean you shouldn't reach out to them. In fact, it means that you have to reach out to them if you need anything. They're not going to call you unless it's that once a year when they're getting your care assessment. So, but you have the right to call or email them at any time, and we encourage you to do so. And they also do need to respond. So if you're calling them and they are not responding, then you are within your rights to go to the supervisor and let them know that that's the situation. If you just call the local DDCS office, you can ask who the supervisor is, and they should give you that information. If you don't hear from them, call the supervisor. You can also call the front desk here. And then if you're still having problems, you can move it up the chain. You can also talk to us at the org, and we will help try to kind of like push them a little bit. So so your case resource manager will know about DDCS services, and they're very crucial for that. They don't necessarily know or have time to help with other things like SSI, which is a completely separate, federal situation, IEPs, etc. So they're not a one-stop shop for like disability supports. They're specifically, they are to like connect you with DDCS. No? Any questions about kind of the use and case resource managers from DDCS? No? Okay, no. Okay, so kind of talked about this already, but for concerns, CRMs are trying their best, but they have a lot of clients, and also it's complicated, getting more complicated as they're making all these changes, and mistakes happen. If they're not talking to you or they're not responding to you, then ask for clarification. Then if that doesn't work, talk to the supervisor, go up the chain, and again, we're also here to help. Any questions about
complaining?
Yeah,
about how to
complaining,
complain.
basically, complaining. Okay. So I guess now it's time for the general question portion of the thing. Any questions in general about DDCS?
Hit us with all your questions.
Yes.
We're ready for them. Yeah.
Can you go back to the slide with waiver?
Uh-huh.
So if I enroll for the waiver, am I waiving off some kind of rights?
That's a good question. So like Elizabeth was saying, the waiver is you're waiving the right for your person to be receive their services in an institution.
Like what? I mean, I don't get it.
Like, okay, so in 75 years ago, 100 years ago, in the United States, when children were born with disabilities, they were institutionalized, like kind of segregated in a...
I can share a personal example.
Okay.
So my brother's in a wheelchair. He's 100% assist. He lives at home with my parents. I'm sure they've signed a waiver. They take care of him. They give personal caregiving hours. but they've chosen not to have him placed in an adult family home or a skilled nursing facility and keep him at home. So,
But
that's not, you're not waiving a right to an adult family home or a
Right.
skilled nursing
We're like,
facility.
wait.
You're not, yeah. Lots of people have waivers and are still in adult family homes. In this case, it's like institutions like we still have a couple, I think there's 2 left, like Lord's institutions for people with intellectual and developmental disabilities in Washington.
Like
and
a
those are
locked
the
facility where
last
people
resort.
are sort of
yeah,
segregated.
those are the last resort. We now, I think there's kind of an agreement by the state, at least theoretically, and by people in general, that we want people with disabilities to be, and definitely at the ORC, we want people with disabilities to be in the community, however that looks like for them, whether it's at a family, like at their home with our families, or if it's an adult family home in the community, etc. So you're not waiving like any of that kind of like care. You're just saying, I want that care to happen in the community as much as it can be done for my person.
And nowadays, like there actually aren't institutions for children
Yeah.
anyway. So they're like, if you needed, and I'm not judging, if you're in a situation where your child couldn't live in your home and you needed them to move somewhere else, that is an option in Washington, but it wouldn't be an institution. And it would come through a waiver.
And it would still be a waiver.
Yeah. Yeah, for sure.
So if we wanted help from the ARC with all of this, because you said we'd come in, do we have to make an appointment with you, or can we show up?
Great question. You can't just show up. You have to have an appointment.
Yeah.
Ta-da. Contact information.
Yes. You can do, we have Spanish line, English, and then if you want to email us in Korean, you know?
I get emails from you guys all the time, so.
Oh, so you know. Okay.
Yeah, but we have a specific ask email, or you can call.
Yeah.
And then,
Yes.
yes.
Well, I will share it and hopefully, I forgot I brought a sign-in sheet.
yeah, we took sign-in, we got
Oh,
a sign-in sheet
okay.
with your email addresses, so
Great.
we'll make sure this gets shared, yeah.
That's great. Yeah. Yeah.
So with the waiver, that just covers all of their needs. It's just like one waiver that you fill out, and that's what they assess.
No, so like, it's not a waiver you fill out. So they're gonna do this assessment, and they're gonna say, yep, your needs are there. And by the way, the assessment is just asking you questions. They're not doing any evaluation of your child. And they're gonna say, yes, there happens to be a spot on this waiver, and the committee decided your kid is the person who's gonna get it. And then you go through a very complicated enrollment process. That's where you get Medicaid. Remember I told you the DDA application's easy, it gets harder later. That's what I was talking about. So you have to apply for Medicaid, and they're gonna do a whole sorts of things, but eventually you will be enrolled on a waiver. And the waiver is gonna pay for the personal care that we talked about, the respite care, and all the other, those are the big ones that parents want. But then there's also other services that you might take advantage of as they get older.
Do they offer like help with like weighted vests or other supplies?
Yep, they can pay for some equipment and materials. Weighted vests, she's asking.
Like the Medicaid.
Yeah.
Get that. Okay.
Yeah, my son, when he enrolled, he was able to use his Medicaid waiver to purchase an iPad to help with communication. Yeah, they do pay for things. Yeah. They don't pay for therapy. So this is a confusing thing that people expect DDCS is going to pay for therapy. It doesn't. What it pays for is Medicaid, which can pay for therapy. But DDCS itself does not provide. They're not a service provider. They're just a payer of services.
So if the child goes on to Medicaid through this, would they still be covered under the family insurance?
Yeah.
Yes.
So, like I said earlier, my son gets Kaiser. That's his main insurance. But his Medicaid pays whatever Kaiser doesn't pay. Medicaid is actually great insurance. The challenge with it is that not all providers take it. So if you have a pharmacy that accepts it or a provider that'll accept it, they will pay the copays that your private insurance doesn't pay. They pay for certain things like the iPad, for example, and the personal care that private insurance doesn't pay for. So yeah, they get the best of both, basically. Yeah. Any questions about DDCS or anything else? I mean, we're happy to answer questions. just encourage you to do it as soon as you can. Now's a good time. It's not as hard as you think. I hope that's your big takeaway from this, is that it will hopefully be worth it long term, even if not right now.
And it doesn't take a long time to apply.
Right, it's not. It's easy.
Right.
Yeah.
So when I received the letter for the 4 years old, right, PA, so I did call them and re-enroll,
Okay.
and I never received a letter.
When was that?
This was this year, but I mean last year.
2025 sometime. Yeah, I mean, if it's within it's possible they just haven't gotten to you yet, because that's what I mean, they are moving very slow right now. But I will also tell you, every time I've applied for my son, they lost our application, like each time. And I had to call them, and then they would, oh, right, here. Like, so I do think calling them and following up is an important part of the process.
Yeah, because I keep calling them and they said, oh, okay, let me transfer you to the person that blah, 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 and then okay. And then after that, and then I never received it.
Right. This is what, reach out to us, because that's the kind of stuff that makes me so mad. Like, we don't need that in our lives. I feel like that kind of like bureaucratic runaround. So I'd love to try to help with that.
And then after that, so since the Washington, the insurance for the low income, right?
Mhm.
And after that, because I stopped working for a year just because of my son. So I applied that.
Okay.
Then I think it's automatically declined it because I think they look the income
Mhm.
for my husband. It's a
Yep.
little bit more
Yeah.
than what you expected.
Mhm.
So there's 1-800 called me again for another insurance. It's not
Mhm.
Apple Health. It's the health plan. It's a different insurance.
Okay.
And they said they set me up for an interview.
Okay.
Until now, I haven't received any.
Yeah. Fun. It's great. Yeah. I mean, it's really frustrating.
Because they get all my information and everything, and they said someone will call you
Yep.
to have a phone interview.
Mhm.
So I was expecting that. Until now, I haven't received it. So.
I'm sorry that's happening. I mean, that is the reality of these systems. And I think about that when I say these are also the systems that are going to be responsible for keeping my son alive at some point in his life. So I need to develop trust with these systems. I need to develop an understanding of how they work. And I want to do that while I am still able, while he's young and the stakes are not as high. Because it is frustrating, and there are those really annoying things where you get into, they said they'd call, they wouldn't call, they lost this, they did that. It's a reality, for sure. Yep, you just have to keep going. That's what we do. We just keep going.
I was talking to someone today, and they're like, I guess I just have a lot of walk in front of me. And I was like, yes, and I'm sorry, and it's not fair, but like, yes.
Right, it's not fair, but yes. That's right. That's right.
You have to keep calling them and keep emailing them and keep hassling them. And it shouldn't be our job, but
one day you will have a caregiver who is great and can come to your home and help with the care of your child, and give them that independence of not always needing their mom or dad to do it for them, and to get out into the community and do a camp that they wouldn't have otherwise gotten to. Like, there are some payoffs at the end. Yeah. What'd you say?
Squeaky wheel is the great.
That's right. That's right. It just, being a squeaky wheel has its emotional cost, but.
What was the first system? So what should we do now?
Yeah, so step 1 is getting determined to be eligible. That's filling out those 2 pretty short applications. That part. That's step 1. For those of you whose kids are under 4, that's already happened. For your kids who are over 4, you have to start from scratch.
if you had ESIT.
Yeah, assuming you had early intervention. Yeah. And then what I always tell parents, because it could be 6 months or a year before this goes through, is that once you get determined eligible, feel free to call us and we'll tell you what step 2 is, because it's hard to remember step 2. Yeah.
So if I'm already eligible for the waiver, will I need to call?
You're not eligible for the waiver. You are eligible for DDCS. That means he's got step 1 done. He's DDCS eligible. Next step is applying for a waiver.
Yeah, so I was gonna ask for that application. Do I need to call them? Like, what needs to
You don't, you need, yep, this is what, this one right here.
Oh, okay.
So what, if you search like DDCS service request, it's a really simple form, that link, and it's like name, address.
Okay, I didn't know just because like I didn't know I was even eligible.
Right,
Like,
of course
I had
not.
a number already that they would ask for that I don't have access to.
Oh, like
I
a
didn't
case
know.
number or something?
Yeah.
No, what they're gonna want is your child's name and date of birth.
Oh, okay.
That's how they distinguish who he is. Yeah.
Thank you.
Yeah. Make sure you use that quote though, like that you want. If you just say, I need services, they're gonna be like, well, what do you need? And if you don't ask for the exact thing you need, they will be like, well, call us when you know what you need, which is just ridiculous. So be sure to say that you wanna enroll on a waiver.
Yeah, and there are a bunch of different waivers, but you can look those up, or we can ask more questions if you have more specific questions later.
Most kids start with the IFS waiver. It's
Yeah.
the individual and family support waiver. It's the one that for kids who live at home with their parents. That looks awesome.
Good time.
Woo! I mean, that pretty much is like, we're done. So
Yeah.
that was perfect
Thanks.
timing.
Yeah.
Thanks, you guys. Our pleasure. Happy to be here.
Thank you for